Miguel. This is Commonconvo. And as you know, we've started this project with Clark County Health Department. As we're talking about health equity, we're talking about the challenges that we face right here in Clark County and surrounding areas with opioid addiction or just substance abuse as a whole. Where we are in our mental health journeys, our wellness journeys. And so I'm excited to consistently be able to bring in different leaders, different health activists, if we will, into the studio and have an opportunity to talk about where we are in our community specifically, things that we're doing right, things that we're doing wrong, things we can do different. And I think it's super important that we stay focused on the task of how do we heal, right? And for that, that's going to mean different things for different people. And so today, I have the amazing Pam Clark with me. Like I say that super amazing because I mean she is phenomenal and does a lot in our community. I'm gonna let her explain a lot of it, and as we have this conversation about how you play a significant part of making sure that we do have equity in all communities across what all racial boundaries, all ethnicities, LGBTQ plus, et cetera, et cetera. So, Pam, and excuse the loud trucks and airplanes that are gonna go by. Because we're in my studio and apparently there's construction down the street. And when you have that, it's there. So if I don't delete it, you heard it. It's not my fault, depending on who's watching, or if you're listening to the podcast. But Pam, getting into here, will you tell our audience who are you and what do you
Mm.
do?
Hey, McGill, thank you so much for having me. As he said, I am Pamela Clark. I'm the Minority Health Initiative Director at Community Action of Southern Indiana. I am funded through the Indiana Minority Health Coalition out of Indianapolis. Who am I? I have been in public health for over 25 years, McGill.
Wow, you don't
I
look old enough to be
I
in
know it.
25 years.
Oh, thank you so much. But 25 years, my son, I think, was three. And someone asked if I was interested in an HIV/AIDS coordinator's position.
Okay.
At that time, I said, sure. I had no clue about public health. I wanted to go into business.
Hmm.
So I did that job for 2 weeks, and then there was a position open up that paid more money. The immunization coordinator
Okay.
paid good money. Okay,
All right. Let's go.
so I took that position to immunize every child by age 2. After I took that position, and a door opened, an opportunity for me to have my own nonprofit. My own nonprofit, 501(c)(3, was Southern Indiana Minority Health Coalition
Okay.
under Indiana Minority Health Coalition. I tell you, I had 13 diseases to address. I wrote grants. I had that coalition for 14 years. Had plenty of volunteers, and it was located in Clark County. After that, I went to work after I lost my mom to cancer. I went to work
Condolences.
for the American Cancer Society for 9 years. I covered the Mid South Division down in the Black Belt, Alabama, Mississippi. And that program was a community based program where we educated women on breast cancer. So, but McGill, this has been like a roller coaster ride for me because public health and losing so many family members to cancer, it became personal. My job became personal to where I've got to make a difference in my community where I live, where my children are growing up, where my family lives, where my friends live. I wanted to make a difference. You ever did something? I think you do. You ever did something where it's work, but you enjoy it so much?
Absolutely, doing this right here. This is. I mean, it's a tedious amount of work, and just on the technical side, being in it. But the other part is that this work for me is still about social justice. So much
Mhm.
of what I cover, it's. I had a conversation with Tia
Mhm.
some years ago and was like, man, if I could just get paid, figure out how to get paid, earn an income, having conversations about how we fix the problems in our
Mhm.
community,
Mhm.
I'd be cool. And
Yeah.
so, yeah, absolutely.
Good. So you know exactly what I mean when I start talking about even relationships. When I start, because you can't do this job by yourself. When I had my nonprofit, I was the only one on staff.
Wow.
But the key was community partners, Clark Memorial Hospital, Clark County Health Department, just churches and other nonprofits, sitting at the table and representing the people you look like. I represent, whenever I sit at the table, I don't care where I am or whose table it is, I represent minority health. I represent people of color. I represent Clark County. And when I say that, that's also to identify resources that in our community that our residents can use those resources to help them feel better, to help them get their screenings, to help them get their medication. But it's not always that easy, Miguel.
We talk about that. Like we always had these conversations about access.
Yes.
We're saying, well, medical supplies is out there, hospitals are out there,
Mm-hmm.
doctors are out there, nurses
Mm-hmm.
are out there. Why is it that one community is saying, hey, I have access, where another part of the community is saying, I don't have access? What makes it so complicated?
Exactly. The difference is that when we look at certain areas of Clark County, there are bus lines, there are daycares, there are jobs. But when we look at some of the other communities, there's not a bus line. There's folks who may not have completed a college education. Education becomes an issue. They may be low income. Um, there are people, Miguel, I would go door to door in some of the communities in Clark County, and I would ask people about their health. I
Mhm.
want to know how you're doing. I want to know if you know about the Family Health Center that's over across the street. Have you used their services? So what I would do is I would ask those questions. If some women may need a mammogram, I had one woman that did need a mammogram, found a lump in her breast, but she was comfortable. She said, I'm okay. What I don't know won't hurt me. Well,
Mm.
see, as Black folks, we do have a tendency to continue with those myths, to continue to say what I don't know won't hurt me, and that's not true. So I stood there and had a conversation with her, told her about the Family Health Center, told her about the breast and cervical cancer program. How many people do you see? And I know I don't hate to say this because you've got to go to where people are. And I know that may sound old cliche, but you have to go and you have to have that conversation. This lady did end up going to the Family Health Center. She did end up receiving services. But if I had not knocked on her door, she may not have went.
You're saying, you have to go to where people are. And we
Mhm.
talk about services, we talk about opportunities, but so I think there's a couple things that come to mind for me, and one is sometimes we don't know the services existed.
Mhm.
The other part is there something that happens in the Black community or economically challenged communities where there's a trust issue,
Mhm.
and so what I don't know won't hurt me
Mhm.
is more so of a reflection of the trust in the
Mhm.
community. I don't trust this facility. I may not trust this doctor. I may not trust this service. I want to
Mhm.
remain private, and
Mhm.
I don't trust that they will
Mhm.
they won't share.
Right, right. And part of that trust, when you start talking about trusting your doctors and trusting um, your provider, it goes back to the Tuskegee experiment. It goes back to history because we pass that information down through generations. And what we have to do is to make sure that we continue to educate individuals on speaking up for themselves when you're talking about trust. My own personal experience of trust with the doctor was when my son was an infant, and they assumed I was on Medicaid instead of having health insurance. They didn't ask for my health insurance card; they asked for my Medicaid card. And I've never been on Medicaid, but when I talk about trust, I'm referring to making sure that we have that open dialogue between our provider, um, and making sure that some people don't trust the prescriptions that their doctors give them. The
Mm,
conversations that I have are, if your doctor gives you a prescription, do you understand what a teaspoon and tablespoon is?
okay.
A lot of people don't understand that. It's really about health literacy and about, again, being your own advocate when you're talking about trusting your own provider. Another example is I had a person in the community said that they did not go to this particular place for care because no one looked like them. And she was a woman, a Black woman. And being a part of the community and having this particular organization on my board, I had a conversation with the executive director, and she made changes.
Awesome.
She made changes because you're not, again, you're working in the community, you're connecting them to resources, but you're also being that ear. You're also, as I said, when I sit down at the table, I represent the people that I serve,
Yeah.
I represent the community.
Let's address that sitting at the table, because I know sitting at the many tables in this community, we
Yes.
might be the only ones.
Yes.
And what you just identified is why it is important for us sometimes to for us as brown Black
Mhm.
people to
Mhm.
be in an awkward space,
Mhm.
right? Being the only one at the table, because when we do voice something,
Mhm.
it may be the first time that anyone on that board or on
Mhm.
that committee has ever heard of that issue.
Right.
And if you don't advocate, if we can't give agency to the people who don't
Mhm.
have agency,
Mhm.
then the growth that we hope will
Mhm.
come doesn't. And you deliver that,
Mhm.
and so you can sit here and say, yes, things have changed. And I've worked with directors and programs who said, man, we don't have
Mhm.
people of color who work here, so
Mhm.
we'll adjust that. Now, not everybody does that. Some people don't care, or
That's right.
they have rhyme and reason.
That's right.
We'll just leave it like that, because I said I was going to play nice on this
Yeah,
series.
you are being really good. You are, because I know how this could go. But yeah, you are, and that's okay. You
Sometimes
know,
there's a time to carry a spear, and there's
it
sometimes to
is.
carry a
It
pen
is.
in a book.
It
And
is.
and on this series, I think it's more about let's
It is.
educate.
It is.
Um, it's a hard conversation, no matter how we look at
It
it.
is.
And because go ahead, go ahead.
Because you have to have that conversation about systemic racism, discrimination. If I feel it, if someone in your office mistreated me and I just leave, you're not going to hear about what happened or why I left. You're not going to follow up with me. But if I see Pam on the street and Pam, this is what happened, I'm going to go back and we're going to have that conversation. It's a conversation that we have to have. When you're talking about discrimination, stress brings on a lot of issues. Stress brings on headaches, hypertension, heart disease. It plays a role in a lot of chronic diseases. So if I'm feeling, and I know you understand this from 2020, because I keep going back with, oh, I know we're being recorded, but Maurice, I keep going back to that, the stress that I felt in 2020.
Yes.
The marches, that the headaches that I had, the concerns I had. Now, see, that brings up social determinants of health. So when I don't feel safe, or if I'm concerned about my teenage child, that's part of public health.
Yes.
Feeling safe is part of public health. So I have to make sure that I address those issues when it comes to safety, when it comes to discrimination, when it comes to um, someone, when I'm being mistreated, when I don't feel like I'm getting the care that I need. And it's okay to speak up. Just like you guys march, y'all spoke up in 2020.
Yeah, yeah. I mean, I think 2020 19, it changed a lot for a lot of people.
Mm-hmm. Mm-hmm.
Um, and I think
Mm-hmm.
for some of us, and I'll backtrack a little bit. I had a couple clients said you shouldn't be out there,
Mm-hmm.
and most people don't even know how I got to the fact that I was protesting
Mm-hmm.
anyway. And it was weird because my daughter wanted to go protesting the first night, the things that were going on in Louisville in terms of
Mm-hmm.
Breonna Taylor.
Mm-hmm.
And so we're in night two, and I'm watching it in the office, and Tia and she'll call and like, I want to go downtown, and I have a voice and I want to voice it. In my head I said no.
Yeah.
And I've been telling this story, and,
Yeah.
and I was like, nah, I'm not taking you down there. You have no idea what that is gonna look like,
Yeah.
And they said, well,
Mm-hmm.
who better to take me than you, Dad? Like, you know what it's gonna look like, what it's
Mm-hmm.
gonna feel like. And I was like, you know what? You're right. What we don't later understand is the
Mm-hmm.
amount of trauma
Mm-hmm.
that we cause to ourselves being in a volatile, um, environment. It was a
Yeah.
war environment,
Oh yeah.
right? Brought on
Yeah.
by both government and people.
Yes.
And so we have to address that,
Mhm.
but it gave such a new voice. I
Mhm.
remember sitting on one SI's board for some years, and we would introduce this thing about social racism
Mhm.
or social equity or
Mhm.
economics, and the fact
Mhm.
that black folks were being excluded and
Mhm.
yada 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 and so on. And we would continue to have these conversations, and they wouldn't really go anywhere.
Mhm. Mhm.
The math didn't math at the
Yeah.
time.
Yeah.
And I think what 2020 showed the US, but very specifically at home,
Mhm.
was that we are not far removed from the
Mhm.
racial inequities that happen across the country. And
Exactly.
in Clark County, Floyd County, and across the river in Jefferson County, Louisville,
Mhm.
there's a lot that are happening that's
Mhm.
intentional.
Mhm.
And it does create harm,
Yes, it
right?
does.
It,
Yes,
it
it
is a
does.
it's a continuation of the inequities that we face
Mhm.
systematically.
Mhm.
And no matter how many Pams are in a place, no matter
Mhm.
how many Miguels are in a place, if the powers don't be, if our
Mhm.
mayors and our governors,
That's right.
people who are head of our health departments, people who are head of, organizations and
Mhm.
banks are
Mhm.
not paying attention
Mhm.
or don't want a culture of equity, then
That's
we have
right.
to address these things, right?
We do.
Because we were not,
We do.
we're, I would like to say we're not safe. For a lot of people, safety in this community, being
Mhm.
black or brown, doesn't exist,
Mhm.
right? We leave the home with a concern that we live in an unsafe environment,
Mhm. We do.
um, both from institution and individuals.
Mhm.
and
Mhm.
and I think, part of this conversation, I think the fact that Clark County Health Department said, let's have a conversation, let's have an open dialogue
Mhm.
about what health equity looks like.
Right. Right.
um, I asked the convers. I had a during the 2020. We were all sitting in these Zoom meetings,
Mhm.
because of
Yes.
COVID, and I
Yes.
asked a question there. We weren't talking about health equity. We were talking about wealth and
Mhm.
economic positioning of the community as a whole. And I remember asking a lot of the leadership in that room, "What does equity look like?"
Mhm.
You're
Mhm.
saying you want to create it, but what does it
Mhm.
look like? And
Mhm.
that conversation never happened. The answer never came.
Right.
And we're in
Right.
2023. um, I want to say the answer still has yet been,
Mhm.
I've yet to hear it, but what I have seen is a few people, a few organizations say, let's step out here and see if we can
Mhm.
figure it out, because
Mhm.
we don't know what it looks like.
No.
And we don't have a plan. Now there are some
Mhm.
folks like Mayor Treva Hodges over in Charlestown has done some really
Awesome.
unique things,
Awesome.
in terms of hiring practices and
Mhm.
programming, and she's
Mhm.
she's been boisterous about it.
Yes, she has. Yes, she has.
You've got CASI, who was doing a great deal of things. And so we have pockets of
Mhm.
folks in the community. The
Mhm.
fact that Dr.
Mhm.
Yazels with the health department is,
Mhm.
is is out here
Mhm.
looking at it and saying, how do we fix it? How do we implement things? What's missing?
Right. And
And
and we have to fix it together.
yeah,
We have to have, when I say together, not just with the health professionals and not just with those folks who are community health workers. We have to we have to bring those folks to the table from the community. We have to have that discussion, that raw discussion from those that it really impacts. Because Black men are still dying
mm,
from chronic diseases, from hypertension, from strokes, from 7 years earlier than white men. And till this day, this is 2022, and we are still at the top of the chart when it comes to health disparities. The gap has not been closed. I remember when I first started, we talked about healthy people. I think it was Healthy People 2018, Healthy People 2016. We're talking about healthy people close the health disparities gap. How are we going to do that? We have to also, we can't leave out the part of advocacy. We
mhm,
can't leave the part out of going to the state house and being that voice and being heard. There was one time they were talking about cutting the breast and cervical cancer program dollars. Who do you think that's going to impact? That's going to
right.
impact women of color. And I don't know if you want to delete this part, but we're also talking about abortion.
Let's
At the
talk about
state
it.
level, we're talking about abortion. We're talking about women of color now going back to the alley to get this botched up job done.
Yeah.
Because we are passing laws that are going to be so strict in the state of Indiana. Even if a woman has been raped, she's not going to be able to get an abortion.
I mean, we've had this conversation on a couple other podcasts, and what does the world look like post Roe v. Wade, right?
Mm-hmm.
But
Mm-hmm.
here's the even crazier question: is what does our community look like during Roe v. Wade? Some communities were already bad.
Yes.
Indiana being one of them.
Yes.
I had Dr. Rita on here in the last session, and we talked about the fact that 1 out of every 4 young women will be sexually assaulted
Mm-hmm.
and abused
Mm-hmm.
before she leaves middle school,
Mm-hmm.
and men one out of 6 young
Mm-hmm.
boys, and these are reported. So I mean, we already live in an environment, right, that is dangerous in that relationship. But here we are passing laws
Yes.
that will, a lot of times they say we're passing laws because we want to protect an unborn child or a fetus, and and I respect that. That's
Right.
but at the same time, we're also passing laws, I think, who are protecting predators.
Mm-hmm.
And I once asked a question of some elected officials. I said, when you pass this law, who are you really protecting? Your friends,
Mm-hmm.
who are out here raping and pillaging,
Mm-hmm.
or the people
Yeah.
that you're supposed to legitimately
Yeah.
protect, right? And I think we have to continue to have that conversation,
Yes.
because I'm a firm believer that we have to protect women's rights. There's no reason we should be making laws that dictate what a woman should or can or can't do with their own body.
Yes.
That is not freedom. That's not independence, and that goes against the American concept, in my opinion.
Exactly, exactly. And another, we don't know how we're going to come out post COVID with mental health in our youth.
Yeah.
That's another
Yeah,
topic.
absolutely.
You know, we've had an increase in, to me, one suicide is too much.
Yeah.
That's too many. So this past summer for our annual back to school event, we talked, I had Centerstone set up a table just for them to talk to parents and to follow up with parents,
Yeah.
because I want to make sure that our kids are feeling safe, able to have a conversation with someone, some adult, somewhere. They've lost friends, they've lost family to COVID. So we don't know how this COVID is the impact that it's going to have on our children, the isolation, I think still with going to school and sitting in the classroom for some is a challenge.
Is it safe to say that COVID, the last couple of years, there's no going back to a norm? This
No.
is our new norm,
Exactly.
and we have to figure out how to
Exactly.
thrive and be safe in it.
Mm-hmm.
I wonder, even in that, like I wonder how many, when we look at the diversity of our community, how many therapists, how many psychologists do we have that are Black, brown,
Right.
who are women, who are of other ethnicities? Because we're not just a Black-white community. We have Africans, we have
Yes.
Hispanics from all different regions. So we really have a plethora of folks. And are we really addressing the needs of the people and the cultures? Is there anything you want to share, like as we have these conversations?
I would like for people to just get involved. Something that I'm working on, uh, and I don't know when I'm going to be able to implement this, but it's been near and dear to my heart, which is crime in the African American community. Something that I would like to do is to start out with a panel of discussion, but I like doing things out the box. I don't like doing the normal things. I want to have someone there from the trauma center, from the funeral home. I want to have a parent there. I want to have a real discussion. But I don't want it to end just there. A lot of times we have town hall meetings and we voice our concerns. We get up, we testify, we tell all these great stories, and then it just sits there. And what happens after that? Again, I'm only one person, but if I can get the community involved, the community to share. And when I say the community, I'm talking about folks that live in public housing, folks that live in $1 million homes. I want to get all these people together in one room so we can talk about it. And then we come up with a plan. bring our mayors, our local politicians, bring all of those folks in to have that conversation. Is it going to happen overnight? No, it's not going to happen overnight. But Clark County, I always say we're not in Oz anymore.
No, no.
It's not where I grew up. I've been here all my life. And it's not, when I'm going to tell you, I was in the hospital, I was diagnosed with epilepsy when I was 3. I was in the hospital. I was in the basement. I was in the basement because black kids could not go. Black people couldn't go. If you went to the hospital and you were admitted in the basement.
That's unheard of.
No.
I mean, it's not unheard of, clearly. That's crazy.
No. I remember that.
Wow.
Yes. My mother never had any complaints in terms of how I was treated. She didn't have any complaints about that. But things have changed, but then again, things haven't changed. Things have been covered up.
Okay.
So we have to talk about that. And you talk about Dr. Yezo, and you talk about Rita Fleming, and you talk about Treva Hodges, and those are just to name a few that are, they're on the front line for all people, for people of color. They're easy to approach. They're approachable to discuss issues that even one individual has a concern about. How can we get together and have those conversations? And sometimes we think, oh, I'm just one person. That's okay. You can be one person.
One person can do a lot.
That's right.
It's the spark that moves things. And I love the fact you said, hey, let's move beyond conversation.
Yes.
We have to have action plans in place.
Yes.
And so if we're going to address equity at any level, if we're going to, address the crime levels that are increasing in key communities, and how do we address that? And it's not just about policing. It is about those who are in the community owning it. Yes. Right, having some degree of ownership, whether you have a mortgage or you're renting. Yes. There's different levels of ownership, and I think the other piece is that we have to look at opportunity. Right, why does crime happen? Yes. What are the reasons? What are the things causing for things to occur, and how do we begin to address that versus just saying, hey, this is something we need to police and somebody needs to go to jail. Yes. I think that has to be a thing too, because when we live in a community that is focused on economic growth, economic means, financial value, and we have communities that are ignored.
Yes.
And we have communities that are intentionally ignored. And we have to address that as well.
Because that's their problem.
Yes.
It's not really our problem.
Yes, when tax dollars came from everybody.
That's right. And something else I want to bring up real quick is that I served on a policy that the state of Indiana is working on called direct service workers.
Okay.
And direct service workers, as you know, are usually are like our CNAs and folks that are caregivers. Even I was a caregiver to my mom and caregiver to my husband, and caregivers aren't paid a lot of money. If we could and what they're talking about doing is identifying a career track, a career path, but also making sure that they have the resources. If a CNA wants to become a nurse, to make sure that she has those resources to become a nurse. Because if we can pull them up to another level, because we have more people aging, we have an aging population as well.
Yes.
Okay. Now, we don't like to put our folks in nursing homes. They're trying to keep folks out of nursing homes. So if we can get our family members, if we can to care for our loved ones, if we can also get our direct service workers, if we can get behind them and the state can pass those policies to help our direct service workers to become more self-sufficient, that would also help our economy as well.
We've got we've got a lot to think.
We've got a lot.
We got a lot to work on.
That's my day.
Yes. Wow.
If you ask me, Pam, what do you do in a day?
That's a long list.
I'm working on infant mortality. I was telling you about the local food purchasing access grant that Community Action just received, and working with BIPOC farmers and working with Black farmers and working those 20 counties and getting fresh fruits and vegetables to those counties, to those folks that live in those 20 counties, and that there's only 5 grants in the state of Indiana that Community Action is the lead agency on. So if you ask me about that, I'm also over here working with doulas. I'm writing a grant to try to I have a couple of doulas that are going to be working with our Head Start families. I have doulas that's going to be working and talking about um, breastfeeding and talking about um, uh, nutrition and physical activity and really focusing on the low income families and making sure that those women have what they need and connect them to resources
How
as
do we
well.
get all of that out there into the ether?
Ooh.
Cause I mean, I'm in certain spaces,
Mm-hmm.
and I don't always get to hear about the different programs.
Mm-hmm.
When I do pick up a newspaper, I don't always hear about the
Mm-hmm.
different new programs.
Mm-hmm.
And in Clark and Floyd County, we really don't have news.
We don't have news
So
like that.
how do we get that information out to the people on an ongoing basis?
We had over 1,000 people, individuals that attended the back to school event. 1,000. Every year there's more and more. We went to the media, our community partners. We were on TV, radio,
Okay.
just trying to get that information out there. That's because people are having a difficult time, hard time with getting jobs or even retaining a job because so many people have been home. It's hard to sit at the desk when you've been home for
Yeah,
a
yeah.
long time.
That hustle is different now.
It's a little different. It's a little different. So what we do is we use our community partners, we use our churches to try to get the word out.
Okay.
I just started a diabetes class last week, every Wednesday.
Yeah.
You know, a lot of us, we still call it the sugar.
Yeah.
And I don't want I have a lady, she's told me she was diagnosed with diabetes, but she said, you know what, I call it sugar. I can't say the word diabetes.
Don't want to own that disease.
Don't want to own it. And
Well, I
we're
mean,
still, we've got people still, that's okay. We don't have to claim
Because we
it.
can address that. But how do you, so are you teaching, so, and I know we got to wrap up, but so in that diabetes class, in that sugar class,
In that sugar class, call it what it is now.
are we teaching new ways of eating?
Yes, we are.
Okay.
And it's not, when I say I'm having a class and it's facilitated by an RN, registered nurse, when I'm saying I'm having a class, it's not where she's coming in and she's lecturing you. This is interactive. We're actually doing food demonstration and we bring in partners to do
Wow.
this.
Can I come film that?
You
one
can
day?
come and you get a
Let's
little
go.
blender.
All
You
right.
get, I mean, you're getting some things to take home. Every class that you attend, you will get something to take home.
Okay.
We have activities that you do. We play bingo, you get a game, but yet and still it's educational. If you
Awesome.
have pre-diabetes, if you have diabetes, or if you're a caregiver to someone with diabetes, please come out to our class at Community Action.
Okay.
We started that class. It's every Wednesday at 4:30.
Awesome. So yeah.
So how do I get it out? I don't know.
Yes.
I think people just call me and say, Pam, what are you doing? Sometimes I don't know where to start.
What if they don't know a Pam? How do they find you?
They can call Community Action.
All
Just
right.
ask for Pam.
And just ask for Pam.
And they say Pam, the minority health girl, and
All right.
they'll put you through.
And we need your help.
Hey, we need your help.
From service to
Yes,
farm.
yes.
So when does the farming program launch?
That we received I'm gonna say in 4 months.
In 4 months?
Mm-hmm.
So we
I'm
get
gonna
to
say
look
in
for
4
that as
months.
well.
You're gonna look
That's
for
really
that as
amazing.
well.
All
You're
right.
gonna look for some fresh produce here in Clark County.
Well, thank you for joining me.
Thank you for having me.
It's been most informative. I hope that if you're
Yes, I
listening or you
enjoyed
get
it.
to watch, you picked up some information. This is specific to Clark County, Indiana. But if you are watching somewhere else or listening somewhere else, ask yourself, what are you doing in your own community? What information do you have? What information don't you have? Are you not getting it because you're not at the table? And sometimes we have to move out of our comfort zones and show up in spaces so that we can get the information and then bring it back to our community. I'm with Pam Clark, with CASI. This is your boy Guy Miguel. This is Common Conversations with the health equity story. Thank you very much, and we'll see you next show.